Now I have another question. I want somebody to read for us. Let me read this one. It's easy. Okay, let somebody read this because this one is a trick one. Who read for us?
I can read. A 25-year-old woman with epilepsy is being treated with valproate. She develops irregular menses and hirsutism. What is the most likely diagnosis? A. Cushing's syndrome. B. Hypothyroidism. C. Polycystic ovarian syndrome, PCOS. D. Hyperprolactinemia.
Okay, so we've learned about polycystic ovarian syndrome, but this is the case where Dr. Bruni has thrown in this wrench. 25-year-old female, treated with valproate. She develops irregular menses. She develops hair. What's the most likely diagnosis and why? Oh, Dr. Tilly says C. And let me see. Looks like quite a number of doctors. Dr. Raphael went for A, Cushing's syndrome. Dr. Shah was not sure. She said D, and she put a question mark there. And Dr. Lady, too, went for D. But the answer is still C. Why? This is a teaching point. Now, let's get ready to go into it. Valproate. So I intentionally threw this question in. Sodium valproate is a medication which is used to treat epilepsy. It has been associated with increased risk of developing PCOS. That's why. So, which includes symptoms like irregular menses and hirsutism. So, don't also forget this. Can some medications cause PCOS? Yes. Some medications, can they lead to PCOS? Yes. Sodium valproate is one of them. Sodium valproate is one of them. So, what are the teaching points of high-risk groups who can develop PCOS? And look down here, look down here, look down here, look down here, valproic acid. Patients who are taking valproic acid. I intentionally kept this teaching point so we can do the tests, then we can go back. So who is a high-risk female who can develop PCOS? Number one, oligo-ovulatory infertility. Patients with oligo-ovulatory infertility, okay? So they are not producing enough, they are having shorter menses, they have infertility, they have concerns with becoming pregnant, and they are not producing enough eggs, and patients who have diabetes, insulin resistance and obesity, and patients who have type 1, type 2 diabetes and gestational diabetes. These are all high-risk people, right? And patients who have a history of premature adrenarche, and patients who have a first-degree relative with PCOS, and patients who come from some specific, ethnic and racial backgrounds, like Mexican Americans, okay? So like Mexican Americans, indigenous Australians as well. And then patients who use anti-seizure medications, and we learned something like valproate as well. So this is a huge learning point for all of us.